Started out like any other normal year. Go ahead, you can go.
Also today, a new exposure site. We're told a non-student, non-staffer went there while contagious.
We knew that it was going to be a crisis.
It was a matter of time that our school was going to have a case.
Were you scared?
Terribly terrified, yeah.
This area of the Pacific Northwest is becoming a hotspot for both children suffering from measles and parents who do not want to vaccinate their children.
Clark County, Washington, made national news in 2019 with a measles outbreak that lasted for months.
It was something kind of waiting to happen.
It started with one case.
But you're trying to work as quickly as you can and reach people.
Then came another and another.
Well, there was an exposure there, so they called and let me know.
During the outbreak, Jessica Fitchell's son battled childhood leukemia at just 6 years old.
I distinctly remember being terrified. His life would be in grave danger if he would have been exposed to measles and contracted it.
In a matter of 3 months, the measles outbreak in Clark County had climbed to 71 cases. The rapid spread happened because the number of vaccinated children was well below the minimum level the Centers for Disease Control says is needed to prevent an outbreak.
Herd immunity, simply put, is just the indirect protection to a non-vaccinated person of being surrounded by vaccinated people, right? Those vaccinated people act like a shield.
But in 2019, Clark County, Washington didn't have that shield.
I got an email from the principal that hey, we're having to shut down.
Schools here went to remote learning a year before COVID-19 closed classrooms everywhere. Science teacher William Barr says it could have all been avoided.
I would say that I felt angry, and kind of frustrated that there was this vaccine skepticism.
Nationwide, the share of unvaccinated kindergartners grew significantly in the last 3 years. And in the 19 states where we analyzed data, the vaccination rates are so low, at least 8,595 schools are now at risk of a measles outbreak.
Across the country here in New York City, they had their own measles outbreak in 2019. 649 people in all. Dozens had to be hospitalized.
In the city of New York.
The city's public health commissioner says while more people in New York City got vaccinated because of the outbreak, the numbers have been declining ever since.
I'm worried about the trend if it continues in that direction.
Do you need to be stricter enforcement? Say if you don't have them, you don't go to school, period.
Enforcement and mandates and requirements are useful as a architecture for community engagement.
The reason rates are down is complicated. 6 different experts we talked with point to political influences, misinformation, mistrust in government, and fear of vaccines.
We now have a misinformation superhighway, which is social media, and you can get pretty sophisticated in the ways in which you target misinformation to certain communities.
Another factor, non-medical exemptions for religious or philosophical reasons. CDC reports exemptions were up in 41 states last school year.
Data showed that people in Maine and Vermont and other places were using a religious exemption as a loophole.
The number of parents claiming religious exemptions had climbed so high in Maine 5 years ago, only half the schools had herd immunity. So churches banded together to change the mindset.
For us, it didn't seem radical at all to say, in this instance, the way we love our neighbor is to get vaccinated, to protect the vulnerable, to protect the marginalized, the young, the very old, the sick.
Maine's Council of Churches lobbied state lawmakers to pass a law to get rid of the religious exemptions. As those ended, more schools reached herd immunity.
We came alongside medical organizations, pediatricians organizations, teachers organizations. It was a broad-based coalition of people that joined that coalition to say, here's the right thing to do.
I just can't wrap my head around why you wouldn't do it.
In Jessica's world, the vaccination rate is trending down again.
It's crazy.
2/3 of Washington state schools are now below the threshold for herd immunity. That's 53,000 students at risk.
Why wouldn't you do it for the 5-year-old kid who, if he were to get measles, he's gonna die?